Good morning. My name is Jordan Abicassis. I am the inventor and the founder behind Atom Rehabilitation and the Performance System. And I want to give you guys a quick background. First and foremost, I want to say thank you. You must have my performance system in your hands, maybe the training guide, maybe you were shown this by someone who already has the brace and is vouching for me as a new transformative way to protect against shoulder pain, neck pain, as well as improving and going through full postural restoration. So again, thank you from the bottom of my heart. I've worked a long time on this to make sure that it is very proficient and all-encompassing in one area. So we'll kind of start based off of what you have in the package. You should have 2 elbow braces, 2 elbow sleeves. You should have the waist belt within the elastic band and the full training guide. The box looks like this. You should have gotten it like this. If you did not see it like this, that means you did not order it yet. So get yours in the box. The 2 elbow braces come in the packs as such. Here are the boxes for the elbow braces here. And then here is the total mobile unit kit. Again, this is an all-in-one mobile exercise tool that can help you improve your scapular function in order to go ahead and reduce your shoulder pain, your neck pain, and give you a full postural restoration technique. So we'll go ahead and open up the pack. These are the sleeves. If you did not receive the sleeves, again, it is because you did not order your brace. So we put these sleeves on. The sleeves are not necessary. You don't have to wear the sleeves if you're the only person using the brace, but I will tell you that for my clinics and hospitals that are currently employing the utilization of the performance system, these are washable. The braces are only hand washable, so it does make things a little bit easier when you're going about it. So we'll go ahead and we'll put both of these sleeves on to go ahead and show you how it functions and how it works all together. We'll take it from there. There's a couple of key things that I'd like to mention about the brace. It is, again, a full mobile kit, which means you can use it on the road, at work, at the gym. You can use it at home. You can use it seated. You can do it standing. For clinics, you're able to go ahead and open up an entirely new station for your patients where they do not have to be connected to a wall. They can walk with the brace, utilizing some of our more plyometric-based trainings, some stability trainings. All of our functions are based off of DNS, that's dynamic neuromuscular stability, as well as PNF patterns that follow suit to make sure that the body is in alignment. Our whole goal is to improve scapulohumeral rhythm. That is the dance that your scapula does, the movement that your scapula does as the muscles are supposed to work properly. Most of us who do have some type of rotator cuff tear, neck tightness, the scapula is typically upwardly elevated, sometimes inverted, sometimes even elevated and downwardly rotated. This creates a impingement here on this side of the shoulder. That's my little anatomy. This is the spine. To give you guys reference, this is the scapula, the big muscle on the lat, all the muscles that connect to the scapula, this triangular shaped muscle. And here is the arm bone, and as you can see, that's where the Atom brace goes, right there on the arm. Okay, so we'll go ahead and we'll start with the waist belt. If you're opening up the waist belt pack, you might not have had this already done, but I have this already done for you. This waist belt allows you to go ahead and exercise anywhere at any time. You are now your exercise station. Your patient is now the exercise station. Doesn't matter where they are or where you are in space. I'll go ahead and I'll put it down there. You see this here? This is where it's connected. I got 2 bands. Each package does come with 4 bands, 2 longer, 2 shorter. This is because we can manipulate the amount of tension that is applied by directly moving the bands across the body, whether they're pulling farther away from the front of the body or even wrapping around the back of the body. We do anterior workouts. We have 4 workouts that work on the chest and shoulders, and then 4 primary workouts that work on the neck and as well as the posterior chain. So anterior chain workouts 4, posterior chain workouts 4. You should see that in your guide there on the base level workouts, but there are so many more exercises that we can go ahead and do. I'm going to back up the camera just a little bit here for you guys, so that way you can get more of a full body view of me. Here, you should be able to see me there. Yep, good. Awesome. Okay, so I got my elbow sleeves on. The braces are next, so I'll kind of show you how I go ahead and put these on in a more proficient way than you may have already been aware. Now here are the braces. It's a bilateral hinge brace. It's made of neoprene, so it is anti-allergenic. It is relatively sweat proof, and it is very, very breathable. There's a little mesh diamond right here in the front. I don't know if there's a glare that you can see, but there's a little mesh diamond in the front. You should have that on your own, as well as the flap. So what we're going to do is we loosened up these top straps here. We're going to slide our arm in, okay? Slide our arm in, pull it up, okay? The diamond should be relatively close to the inside of your arm, which means that if you can't get it naturally by pulling on the top of the bands, you can use the rings, lightly go ahead and pull. Now we're going to undo the top strap here, pull that across, tighten the flap, make sure that the bottom strap is over that, tighten the first one here, and then redo the second one, okay? All right, tighten that on. These are tension strings here to make sure that the brace does not move. You should be able to bend your arm. This should be relatively close to the inside of your forearm there. We'll go ahead and do the second one, same thing. Putting the brace on. This is a bilateral system because the body does not work in unilateral fashion. We need to balance the entirety of the spine and balance the entirety of the back. The scapula does need to be pulled. There's a term called reciprocal inhibition. This means that no two muscles can be activated, no two opposite muscles can be activated at the same time. That is what creates the impingement, the biomechanical failure of the arm, as well as the total tightness across the neck and postural inefficiencies. Okay, so we got our elbow braces on, we got our waist belt on. You see this here. I'm going to start with the anterior workouts for a second, but actually before I do that, let me kind of explain what happens here with our little anatomy guide. This is Adam. All right, so here we have our scapula. The purple linings are the tendons in across, and you see here, this is the acromial humeral joint right here, or the glenohumeral joint with the acromion and the humerus right here. Now, what happens is that I'm going to get a little marker here. What happens is that when we raise the arm, we're going to raise the arm here. When we raise the arm, if the scapula does not have proper functioning movement, what happens is that this tendon right here begins to rub right there. That's literally 90-something% of all rotator cuff issues. This is the subscapularis that lines up underneath here, and then it connects to the top upper part of the arm bone here, so you get a lot of pain here. Sometimes people experience it right there on the inside of the shoulder, right there on the anterior side. But this becomes impinged. This now becomes an impingement, okay? But what also happens is that this impingement, we end up lifting the scapula because of poor posture, right? So we're sitting here, we're sitting like this, right? And now the scapula, no matter how hard we do it, does not have proper rhythm. And without the proper rhythm, we cannot take care of that impingement. Now, what surgery does, okay, so they'll correct the fraying, and they'll actually end up severing and cutting out part of this bone right here, okay? They'll cut out part of that bone. And so when you lift your arm, while yeah, you can lift your arm without pain, but the mechanics of the scapula are not improved, which means that you're susceptible to more shoulder pain, more neck pain, more tightness, postural inefficiencies, because your scapula does not have the proper biomechanical movements in order to do that. And that is exactly what the Adam Performance System corrects for. And your doctors aren't gonna tell you this because they just don't understand it well enough. Your physical therapists aren't understanding the whole scapulohumeral rhythm well enough to understand that that is what the primary driver of most of your pain and your inefficiencies are coming from. So our whole goal throughout all of our processes is to go ahead and we're going to take this here, this scapula, and we're going to begin to move it down. We're going to pull it down and back. And not only are we going to pull it down and back, but we're going to train the muscles to be able to pull down and to push in all opposite directions and in all motions. There's 6 primary motions. We've got an upward rotation, a downward rotation. We've got protraction, retraction, and elevation and depression. Our system and the framework that we have put together, that I have put together, does exactly that. It trains your body to learn how to manipulate these muscles. It turns them on. It gives you the feeling, that bodily awareness called proprioception. It gives you that feeling of being able to control these muscles, whether you are in pain now you're working towards an injury prevention strategy, or even that you want to use it as a warm-up for a gym, and even postural restoration to begin to start to learn to control these muscles on a deeper and better level. So let's kind of dive in a little bit as to how the system works, because I'm sure you guys have it and you're wondering. So I got the bands on. I only got 2 on right now. There's 6 different stages of the advancement of the brace, but we're going to go ahead. We'll start with the posterior or the anterior side. So I'm going to turn around right here so you can see it. Now we do a cross-body fashion of all of these connections. Okay. Now I kind of mentioned something earlier. 6 different stages. These work based off of 2 different sets. You either have the beginner set, which is the blue bands, or the athlete package, which are the black bands. The blue bands are 10 pounds of resistance that actually vary based off of the stage. So you're only at about 3 pounds of resistance all the way up to 20 pounds on the blue bands. And then we have about 7 to 8 pounds of resistance all the way up to 50 pounds of resistance on the black bands. Okay, first exercise is a snow angel. We do a scapular glide. So we're now training how to get this proper scapulohumeral rhythm here. Okay, that's our first exercise. Second exercise, simple lateral raise. As you can see, the bands are cross-body behind us, so it keeps us nice and tight, pulls the scapula back and down in every single movement. You cannot achieve this with bands. You cannot achieve this with dumbbells. These are very complex motions that we have devised, that I have devised to be able to connect to the waistband to pull you back into that proper alignment and that proper form. All right? As you can see here, the simple lateral raises, we go ahead and raise up and we pull ourselves back. Again, this belt and this system will pull you into proper alignment throughout the entirety of the duration. Next thing we do is frontal raise. Okay, we come up nice and here. We can go ahead and lift all the way up, all the way down. Now there's so many parts of this rehabilitation program that these are just part of the exercises, but we work on rib flares. So we tuck our core in, we bring this nice and tight, because no matter if you're like this, you lift up, oh, my arms are straight. No, they're not. This is straight. Rib cage tucked down, arms up and back behind the ears. That is proper posture. That is proper control. Okay? And then the last exercise, we do a big bear hug. So we go ahead, we go through full stretch. This is, if you can see my shoulder blades in the back there, and now we come across, make a joke. It's not a koala bear hug. We're not coming down here. We are coming up to hug a grizzly bear, and we're going through full protraction and full retraction. This is a full stretch here, okay? These are our 4 primary anterior exercises. Now, to show the simplicity of the brace and the brace system, all we're going to do is we're going to take that off, right? And now, as you saw, the bands were behind me. That means that because tension is pulling me back, I'm utilizing my chest, I'm working my shoulders, frontal delts, a little bit of lateral delts right here, some upper chest and things, right? We're controlling. The braces control for the form, so you're not using your triceps much, you're not using your biceps much, you're not using your forearms, you can't really bend your elbows much, because all of that control directly relates back to the utilization of making sure that we work the proper muscles and get the proper alignment and the proper stabilization that you need in order to fix your shit. Okay, next thing, very simply, I'm going to take the band, I'm going to turn it around, I'm going to put it in front of me. Guys, this is really simple stuff here. If I lost you, I'm sorry. You see? You can see bands, rings are in front of me. I'm going to take it, cross it across the front of my body, connect it to the inside ring. There's 3 rings on the brace because we use all of them. Take it here, put it there. Great. Now tension is pulling my body. We're pulling inward, right? See this hunch, right? Everyone's used to this. This is how you sit, right? This is normal. This is retracted. This is protracted, hunched forward. Now we're going to take this band hunched forward from here, and we're going to lift up, okay? And we're going to pull it into a victory Y. We're straight diagonally pulling, and all of that's doing, this is going to contract all of these muscles here. All of these muscles, we're pulling this now, pulling this back, and we're working on the top end all the way up to your neck, because that's what this is pulling. We're pulling this back. We're pulling and teaching these muscles how to engage properly. We're pulling up, pulling back. And we're going to do these till we get tired. Now the next exercise is going to be a lateral abduction. We're going to pull outbound, right? So now we're going through full protraction again. A little bit hunched forward. We're going to pull back and we're going to stand up nice and tall. This is going to teach your body again. We're slowly moving down. First exercise, For the posterior side, we're working really upper trap, upper neck. Now we're moving down the chain, more rhomboid, more scapula. Again, scapular retraction, learning how to utilize these muscles in order to go ahead and pull the body back into proper positioning. Then I'm going to do a high elbow raise. We're getting a little bit lower. This is a little bit more lat engaging, right? Lat's your big muscle here. We primarily control for it by stabilizing the arm. But your lat is going to be doing a lot of this work here as we learn to pull down the scapula. Pulling it down. We're working our way down there. Working our way down. We're internally rotating as we go through this. Right? Again, same thing. Hunch forward and then boom. See that? See that type of, this is the activation that you cannot get through anything because nothing controls for the movement of your elbows and the movement of your arms in the exact way that your body was biomechanically designed to do. And that's what we're doing. The last exercise here, we're going to stand a little bit forward and we're just going to begin to raise our arms up, back, down. Now the framework is so sophisticated but yet so simple because each and every movement has an opposite reaction and pull. Treating the upper body like a system, a 360-degree system, is what will allow you to begin to create this push-pull reciprocal inhibition to drive that scapulohumeral rhythm back into a biomechanically favorable position. That is what we're going to be aiming for. That is what we will be doing. That all of our framework, and the reason why hundreds of individuals right now have cured chronic shoulder pain, chronic shoulder and neck pain in less than 30 days at a time, because this system is not common. I don't expect my clients to be biomechanical experts or physiologists or physical therapists, and let alone even the ones who are. They don't learn enough of this. They don't learn how this creates the impingement, how that drives the pain and the pressure, or the surgeons that are necessarily wondering why their patients aren't finding better success rates. And it's because this type of utilization is so misunderstood within the physiological field. We need to do better, and that's why I created the system, to make a difference in what people can have at home, in clinic, at the gym. No matter where it is, where you are, you can go ahead and improve your body in less than 5 minutes a day. I know it sounds ridiculous. How is someone going to improve their body in less than 5 minutes a day? Because you just saw on the mobile kit how fast I can work through this, how fast I can go ahead and teach these movements, and you can begin to strengthen in order to go ahead and improve your life, improve your posture, reduce your pain, and really fix the underlying mechanics as to what is causing pain and creating injuries. I don't care where you are in your fitness journey. If you're a bodybuilder, if you're a full-time sports athletic, if you are just the average Joe, it doesn't matter, because this type of training has been adapted to be scalable from the beginner level all the way to the advanced athlete. If you want to prevent your injuries, you need to be doing this type of scapulohumeral rhythm, because over time, you might not have pain today. You might not have pain tomorrow. But if your scapula is not moving in the correct way, you will end up fraying parts of your rotator cuff, creating this tightness that creates an inefficiency within the trap, within the rhomboids, within the lat, and you will start overcompensating, and over time, you will end up developing very poor biomechanics, and it'll be much harder than if we prevent it rather than treating it. That being said, thank you to my clients who are watching this. Thank you for those who have supported me along this journey. And thank you for trusting me in order to go ahead and create the new innovative framework as to how we will continue to treat and rehabilitate our patients with shoulder pain, neck pain, as well as going through the postural restoration techniques. Again, my name is Jordan Abicassis. I'm the inventor and the founder of Adam Rehabilitation. I'm here to help. If you want to contact me, call me. You can call me. It's 954-288-1614. You can email me at info@adamrehabilitation.com. Our system will change your life. I promise you that. It'll change the way that you rehabilitate and take care of your patients. It'll improve your success rates. It'll improve your retention rates in your clinic, and it'll get people stronger, better, than faster. The whole 50-50 shoulder surgery system, I don't know if you guys know, but let me tell you a little bit of a story. 50% of shoulder patients, they did a study where 50% had a sham surgery, which is fake surgery. They opened you up and they sewed you back up. They didn't do anything. 50 other ones, they fixed them, right? They had the same results. Why? Because the difference was lying in the underlying mechanics. The ones who were able to fix their mechanics got better. The ones who did not, did not. And that was the difference between those two. If you have any questions, reach out to me. I'm happy to help.